Now it's time for our sponsor's perspective portion of our program. Welcome Eli Perez, Senior Director of Patient Advocacy and Stakeholder Management at Otsuka, in conversation with Deborah Barrett, Vice President of Corporate Affairs at Otsuka. Welcome. Thank you both.
Good morning, everybody. I can't tell you how delighted we are to be here this morning. It's nice that we get a little short period of time to share our perspective, because the other conversations, and you can tell from the first two this morning, are just so vital and important. They underscore for me what we've been talking about recently, which is that the conversation around mental illness has been shifting. There is a greater willingness to share experiences, to talk about impact, to focus from a policymaking perspective. I mean, the good news last night that we now have a Senate caucus on mental health. That's excellent. That's progress. That shift is really welcome, because how we identify, diagnose, educate, and treat mental illness is a critical need now. You heard, and you've heard many times over, the numbers about the breadth of the incidence. 1 in 5 American adults is suffering from a mental illness. But what we didn't say again today is more than half of those people are not getting treated. So 28 million American adults with a mental illness are not getting treated. Can you imagine 28 million people with a broken arm or a heart condition not getting treated? It's unthinkable. And at Otsuka, and this is why we believe what we believe strongly in the value of every mind. And that is why everything that we do is focused on fighting to ensure that individuals with mental illness get the same kind of care, treatment, attention, and focus as those with any other disease. So what I want to do is turn over to my colleague Eli. You work every day, Eli, with the patient advocacy community. We've talked about how the national conversation is shifting. Tell us what's happening at the individual level. What is working? What's going well? And what more do we need?
Thank you, Deborah. Good morning, everyone. It's great to be here. So the first point I want to jump on is, and Gabe's not here now, but I'm going to share something that he shared with me, because he's done a lot with regards to educating myself and my colleagues with regards to mental health, mental illness. And the one thing I want to point out is we're using these terms today, mental health, mental illness. Hey, Gabe. What I want to point out, though, is that I think we need to be clear on the language and what we're talking about. And it's great that on the national level, there's a lot more recognition of the importance of mental health, that we all have mental health that we need to care for. But it's also very important, and much more important, to understand the impact on individuals living with mental illness. Mental illness and mental health are not exactly the same, and sometimes we conflate them together. When we do that, and this is something that Gabe shared with me, during COVID, it impacted everyone profoundly. It impacted individuals living with mental illness very differently. And one of the things that Gabe shared with us was the idea that we have to raise the urgency on reaching these individuals. The supports that they need are very different, and we need to understand that uniqueness to living with mental illness versus caring for your mental health. Both very important, but we have to understand the differences between mental illness and mental health. So that's one thing. The other reason we need to separate these is when you look at even mental illness, you have to dig even further. They're not just all one disease state that you lump all together and you call mental illness. There's so many different conditions that individuals are living with, and we need to understand that. They're each unique. They bring their own challenges. They bring their challenges with regards to symptomatology. They bring challenges with regards to level of insight an individual might have into their disease. It's very different with regards to supports that an individual might need to receive, depending on their mental illness. And so we need to understand that. We've seen many times individuals who are misdiagnosed, and just the additional pain, emotional, mental, that can bring when you don't have the diagnosis correct. So it's very important to understand that these are very different disease states, conditions, that need to be fully understood, and the individual needs to be understood. What are they trying to accomplish in their life? Where are they? What supports do they have? And so it's important to really dig deep and understand each individual, what they're living through, what their challenges are, and how best to meet them where they are.
Thank you for going there, because it feels like we shouldn't have to say it, but mental illness is not monolithic. And the idea that people think it is or don't understand it well actually ends up being, the misunderstanding ends up being a barrier to getting the care, to people reaching out and getting the care that they need. So that's, I think, a really critical point. I just want to add in a couple of other barriers that, again, we talk about, but they're worth underscoring. One, and you heard it this morning, is kind of workforce shortage and the fact that people just don't have access to a provider. I think Representative Trone said it, but half of the US population lives in a workforce shortage area. We talked about, and I had looked at this, they're estimating one mental health provider for every 350 individuals. That doesn't make any sense. And the problem is even worse, obviously, in rural areas of the country. 65% of rural counties don't have one psychiatrist in them. What do people do when they need care? Where do they turn to? I would also just add very quickly, besides having a provider to turn to, we know that another very big barrier, and we talk about it a lot, is the stigma and discrimination and the issues of the fear of being ostracized or treated unfairly because of a mental illness. Stigma is influenced by cultural beliefs, by attitudes, by values. So it's at that community level where we need to be doing the work to try to address stigma. I do want to give a shout out, because it's nice for us to identify good things that are happening, to the work that CMS, for example, and others are doing to try to integrate more community-based services because of the issues around stigma and discrimination and other things into the integrated care model. That is really, really critical, and we need to see more of it. The point here is that these services, these things are not nice to haves, they are things we have to have. So I guess I wanted, they're critical to the success of what we're trying to achieve here. Again, based on the experience and the people you're talking to, what types of support, can you be specific about the kinds of support and initiatives that are working, and where the gaps are, what we can do about it?
Absolutely. So in the work that I do, connecting with the community, and that includes healthcare professionals, that includes patient advocacy organizations, individuals living with various mental health conditions, a few things really pop up. One is the power of the peer, right? The idea of having an individual who has walked down a path, come alongside a family who honestly feels lost and don't know what to do. Being able to have that peer come alongside them and help guide them is tremendously powerful. Healthcare professionals, definitely a workforce shortage. And also those that are there are working under tremendous constraints, time, other constraints. And so being able to have a peer come alongside when an HCP can, or a healthcare professional can't spend that time that they want to with a family, connect them with a peer. Have that peer come alongside them, guide them. Related to the power of the peer is the power of advocacy organizations. And I see Dan Gillison there in the back, and have attended meetings with NAMI. And all too often, and we've heard this from other groups, the idea that their members, folks who have come to them, kind of speaking out on the fact that I wish I would have known about you 10 years ago. My life would have been so different. That needs to change. And so with that workforce shortage, those constraints, why not refer that family to an advocacy organization? There's power, there's education that can take place there that the HCP can't deliver. And so there's power in working with advocacy organizations. Transitions of care, back to the peer, being able to transition from, we know that our system is broken and there are too many gaps where folks are falling through the cracks. Having a peer there who can help that transition of care take place in a way where there's continuity, questions are being answered, that family knows what to do, there's power there. Goal setting, I think, is a huge need with regards to learning. HCPs rightfully focus on symptoms and how to address them, but what else is the individual working towards? Let's come up with a plan that takes those goals into account, those individual goals, in order to make sure that the supports, the treatments that are being considered help that individual get there. And last, I know we're running short on time, but I do want to share with regards to care partners, care supporters, caregivers, whatever you want to call them. It's very different based on kind of the disease area, the condition, with regards to that level of support. But we know that the impact on that other member is profound, and so their needs need to be taken into account as well.
Thank you. I mean, the truth is there is so much to talk about here, which is why I'm glad we're having this conversation today. We appreciate everybody who is with us and who is offering their perspective and working hard on this. We too are joining you and are committed, even more committed than ever, to try to advance the conversation, support the right kinds of solutions, continue to do research and development and bring innovative solutions to individuals who need them. And we look forward to the continued conversation. So thank you for being with us today.
Thank you.